Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and in this video we're going to discuss Medicare Supplement plans versus Medicare Advantage plans. What are the differences between the two so you're more educated and you can make an informed decision about your health care. Health insurance is really important. We want you to feel confident in the coverage you have. So let's dive in, talk about Medicare Supplement versus Medicare Advantage. So these are your two options. You have Medicare with a supplement over here. When you go with original Medicare and a supplement, you still have original Medicare. You combine original Medicare with a supplemental plan, which we will discuss, and then you get a standalone drug plan to go with it to cover your medications. That's called Part D. Or you come this route, you get a Medicare Advantage plan where everything's wrapped up into one policy. It's also called Part C. So you're choosing between these two options. Let's start with this, Medicare and a supplement. But first, let's talk original Medicare. How does the supplemental plan work with original Medicare? Well, first off, there's two parts to original Medicare, Part A and Part B. So Part A of Medicare is your hospitalization. All these years you've been working and they're pulling money out of your paycheck for taxes. The portion of your taxes that went to Medicare paid for Part A, you've already paid for it, you already bought it. So there's no premium for Part A going forward. You already paid for it. That's your hospitalization. If you're admitted to a hospital, Part A kicks in. Part B is everything outside the hospital. Primary care doctor, specialists, emergency room, even your outpatient procedures all fall under Part B. These are the two parts of Medicare. So Part A, if you're admitted to a hospital, this shows you, if you have no supplemental insurance, this shows you your out-of-pocket exposure. So day one, under your hospitalization, Part A, you're admitted to a hospital, you pay $1,676. These are 2025 numbers. This is your hospital deductible. It will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital and you stay there for a few days and you go home, well, let's say 2 months later you're back in the hospital, you're going to pay this deductible again. So it could really ding you a few times in a year if it's a rough year health-wise for you. If you're in the hospital for over these 60 days, now you have a per day copay of $419. And if you're in there over 90 days, that doubles to $838. These are per day copays that can really add up. Skilled nursing is also under Part A of Medicare. Skilled nursing is basically a place to recover. So if you have a life event, a heart attack, a stroke, or if you have a hip replacement, and your doctor says you're stable but you're not quite ready to go home, they will often move you to a skilled nursing facility basically to recover. So this is where you're going to have registered nurses taking care of you, and you have your physical therapy, your speech therapy, occupational therapy, things like this until you're ready to go home. Medicare does cover the first 20 days. So you pay nothing for the first 20 days. After 20 days, now you have a per day copay of $209.50 that you're paying each day in that skilled nursing facility. So that's a little bit of a bird's eye view at your out-of-pocket exposure with your hospital stays. Now, Part B of Medicare does have a premium tied to it of $185. This will just come out of your Social Security check automatically. If you're not drawing Social Security quite yet, then they'll bill you quarterly. So take 185 times 3, that's what you're going to pay every 3 months. This is the standard premium in 2025 that can go up based on income, so your higher income earners may end up paying more, but most people on Medicare are paying this $185 a month. Part B of Medicare, everything outside the hospital has its own deductible of $257. This is an annual deductible, so it's separate from your hospital deductible. It's a separate deductible. It only applies outside of the hospital, and it works differently because it's annual. You just pay it once a year. Once you've paid that $257, Medicare is going to kick in. They're paying 80%, you're paying 20%. So anytime you see a healthcare professional, you're paying 20%. Primary care doctor, specialist, emergency room, even your outpatient services, you're paying 20%. The big issue with these costs is if you have something going on where you're receiving regular treatment, let's say you have cancer and you're going through chemo, radiation, things like that, you're going to keep paying this 20% with no stop loss. There's no max out of pocket with Medicare. All of these costs are why people get a Medicare Supplement plan, which are also called Medigap policies. They fill these gaps of Medicare. And so what the government did is they designed this chart of 10 Medicare Supplement plans. They told all these private insurance companies, if you're going to offer a supplement to Medicare, you can, but it has to be one of these 10 plans. So these companies can't make up their own supplemental insurance to Medicare. They can choose which of these 10 plans they'd like to offer, and they can decide how much premium they'd like to charge. But coverage-wise, like the Plan G is what we're going to focus on today for this video, because the Plan G is the most popular plan because it's the most comprehensive plan. Well, a Plan G is a Plan G is a plan. It doesn't matter if you get this Plan G, what company you go with, they all have to abide by the government's rules, pay how it's designed to pay, cover how it's designed to cover, but they're all going to charge different premiums. So this is something we explain to clients we work with all the time. We pull up every company that offers these supplemental plans in their area so they can see what premiums they charge and make a more informed decision with which company they want to work with. The Plan G, when you combine a Plan G with Medicare, if you were to end up hospitalized, this Plan G is going to pick up right where Medicare leaves off. It's going to fit the bill for all of this. You're going to pay zero. You don't have to worry about the deductible, your per day copays in the hospital, your skilled nursing copays. That Plan G is fitting the bill. You're essentially just going to receive a statement of benefits paid in the mail. It's really dynamite coverage. It really is. Outside of the hospital, you do have this $257 deductible. That Plan G does not cover that deductible for you, but remember it's annual. So you pay the first $257 a year. Once that's been paid, now Medicare kicks in. They're going to pay 80%. This Plan G is going to cover your 20%. So when you combine a Plan G with Medicare, you have no network. Any healthcare professional in the United States that takes Medicare is also going to take that Plan G. You have a one-time annual deductible of $257, and that's it. It's really dynamite coverage. So that's one option. Now, if you go this route, remember, you do have to get a standalone drug plan. If you go this route, Medicare reviews your health insurance and your drug coverage separately. So this, everything we've looked at is only your health insurance. Then we're going to want to plug in your medications, how many milligrams you take, what pharmacy do you use. We're going to run that through all of the available standalone drug plans and get a drug plan to go with Medicare and a supplement. That's your first option. Now, your other option is Medicare Advantage. What's Medicare Advantage? Is it really to your advantage? So Medicare Advantage is also called Part C. So Medicare Advantage plans work in that the government's handing responsibility for your health care off to a private insurance company that is now managing your health care. They are now dictating your care. So these Advantage plans are managed care plans. They are run by private insurance companies. Those companies are now fully responsible for your health care. So it's important to understand with Advantage plans that you still continue to pay your Part B premium. In 2025, this premium is $185. You're going to continue to pay that premium, but the government's going to take that premium, they're going to give that to whatever Advantage company you've signed up with. Since that company is now dictating your care, they receive that $185 per month. Also, the government's going to subsidize that company each month you have that plan. So that company is going to receive the Part B premium plus subsidy from the government. The government's essentially going to roll the dice, saying in the long run, we're going to save money because we don't have to pay for your claims. So these companies receive your $185 a month Part B premium plus subsidy from the government. So between the two, they often offer you these plans at zero additional premium. That's one of the big advantages with these Advantage plans. If you go with Medicare and a supplement, you're going to pay a premium for that Medicare supplement plan, and then oftentimes the drug coverage that you have to sign up with also comes at a premium. With an Advantage plan, they're often zero premium plans. Sometimes you might pay a little bit, but a lot of times they are zero. That's one of the big advantages. Now, these Advantage plans are going to work a little bit more like health insurance that we're used to, where you do have the network. So you're going to want to make sure any healthcare provider that you use is in network before you pull the trigger on signing up with an Advantage plan. You're going to have copays. You might have a deductible. You're going to have a max out of pocket. So with an Advantage plan, you're going to have, if you go to a primary care doctor, it's a lot of times zero copay. Maybe it's $5 or $10. If you go to a specialist, you might pay $25 to $40 per visit. If you end up hospitalized, you're going to have a per day copay, but you're not paying any monthly premium for that plan, and they're all going to have a max out of pocket. Maybe it's $3,500, maybe it's $4,500, maybe it's $5,000. But all of the plans that you can choose from will have a max out of pocket. So once you hit that max out of pocket in a year, if it's a rough year health-wise for you, well, then you pay zero for the remainder of the year for any health care that you need. And then come January 1, everything resets. You start over at zero on your max out of pocket and you start paying copays again. So you do have max out of pockets. It is a pay as you go. What are the advantages with these Medicare Advantage plans? Again, they are less premium, oftentimes zero premium plans. Then they include ancillary benefits. If you go with Medicare and a supplement like a Plan G, well, there's holes with that, like your dental insurance and your vision coverage, things like that. If you go with an Advantage plan, they often include dental and vision with the plan. Sometimes you can choose to add them with your Advantage plan where you pay a little premium, but a lot of plans have dental and vision included in the plan at no additional cost. So you have ancillary benefits like dental, like vision. A lot of these Advantage plans have over-the-counter benefits where they give you a certain stipend every few months to spend on Tylenol, ibuprofen, Band-Aids, vitamins, things like that. Silver Sneakers is really popular with Advantage plans where they offer you Silver Sneakers, which gives you free access to the YMCAs, the Genesis Health Clubs, Anytime Fitness Centers, more gyms than I can probably memorize. You have free access. These are all additional that do not come with original Medicare and a supplement. These are add-ons. They include, a lot of these plans include drug coverage with your Advantage plan, so it's all wrapped up into one policy, whereas Medicare and a supplement, you have a separate supplement versus your drug plan, they are separate policies. And then there's no underwriting with these Advantage plans. You don't have to answer health questions or get approved with a Medicare Advantage plan. These are all advantages. These are a lot of the benefits with Advantage plans many people enjoy. What are the disadvantages? Number one, they are network plans. When you go with Medicare and a supplement, like we said earlier, any healthcare provider in the U.S. that takes Medicare also takes that Medicare supplement plan. There's no network that you have to worry about, whereas Medicare Advantage, they are network plans. So these plans are going to vary depending on where you live. Now let me pause for just a moment and go back to the government subsidizing these companies. The amount of subsidy that these companies received is based on the population for the area that you live. So a lot of people that live in rural communities are not going to have as benefit-rich Advantage plan options because those companies just don't receive as much subsidy from the government. So it's really important to do your homework in your area and just see what Advantage plans are available to you. Do they have a robust, healthy, good-sized network that's available to me, and are they viable options? So there's certain things that dictate the amount of subsidy they receive, like their star rating, the population for the area that you live, things like that. So one of the first disadvantages, they are a network plan. It's something that you're going to want to pay careful attention to. Also, there's higher out-of-pocket costs with Medicare Advantage. If you go with Medicare and a supplement like a Plan G, again, no network, $257 annual deductible, and that's it. When you go with an Advantage plan, you're going to pay as you go. So like we said earlier, you have the copays with the primary care doctor specialist. You'll have an emergency room copay. Maybe you pay $140 for an emergency room visit. Your CT scans, your MRIs, maybe you paid $250 for those types of services. So you're going to pay as you go until you hit your max out-of-pocket. So there is potential higher out-of-pocket risk with these Advantage plans than Medicare with a supplement. But again, you're not paying that monthly premium. And then they are managed care plans. So what that means is your healthcare provider is dictating your care. So if a healthcare provider wants to prescribe something for you, a procedure or a test, they have to get the green light from the Advantage plan before they can proceed. So these healthcare providers are not as big of fans of these Advantage plans because they have to jump through more hoops to get things prescribed. So for example, if your doctor says you need to have a knee replacement, well, if you have an Advantage plan, that company can tell you, well, let's try 3 months of physical therapy before we approve the knee replacement surgery. Those are types of things you can deal with on the Advantage plan. So that's a disadvantage with the Advantage plans. Before you enroll in a Medicare Advantage plan, there's 3 things we always advise our clients, always talk through before we ever pick an Advantage plan or enroll in an Advantage plan. One thing is network. I've already stressed this, but just to make a point on it again, you want to make sure any healthcare provider you use is in network before you pull the trigger on the plan. Number 2 is drug coverage. When you go with Medicare and a supplement, you get a standalone drug plan. Well, we can decide what drug plan you go with based on what medications you're using. With an Advantage plan, Whatever drug coverage that plan offers is what you get. So you want to make sure that that plan you're looking at covers your medications well before you ever pull the trigger on that Advantage plan. When we talk with you, we're going to plug in each healthcare provider you use, what medications you're on, how many milligrams you take, what pharmacy you work with. We're going to have all of that stuff plugged in on our computer, running through all of the Advantage plans options available to you, so we can make sure we're selecting an Advantage plan. If that's the route you take, we can pick an Advantage plan that we know works really well with your medications. And we can make sure that your healthcare providers are in network with whatever plan we're looking at. Those are really important things to look at before you ever pull the trigger. Third thing that I always talk about is reputation, because these plans are dictating your care. They're managing your health care. So before you ever pull the trigger on an Advantage plan, well, let's have a dialogue. Medicare is the air we breathe. It's our thing. It's the world we live in each day. We're familiar with these companies. So let's have a dialogue on what companies out there we are okay with working with, what companies would we never sign our moms up with. That's something we can have a conversation about, and we'd love to walk you through the plan options available in your area. One other thing I want to notate on these Advantage plans is they're moving targets. They do change each year. When you go with Medicare and a supplement, they're steady Eddie. I mean, your premiums over time on that supplemental plan will go up, but as far as your coverage goes, that they're steady Eddie. The benefits are just year after year, dynamite coverage. Whereas if you go with an Advantage plan, these plans can change and do change year to year. So they can change their copays, their max out-of-pockets, they can change what dental insurance they offer, they can change their formularies, which is what they use to determine how they cover medications, what medications they cover, how well they cover those medications, things like that. These plans are moving targets. So there's the annual enrollment period, which is in the fall each year, October 15th through December 7th. In this annual enrollment period, we're going to want to have a conversation about your plan to make sure it's still the right fit for you in the coming year, or is there a different plan that may be a better option because of changes that have been made. So they are moving targets. It's really important to have a dialogue and look at which route you should take each given year. Medicare Advantage plans have grown in popularity. We have actually hit the point where now 51% of Medicare beneficiaries across the U.S. have a Medicare Advantage plan. That doesn't mean it's the right fit for you. You can decide which of these two plans you'd like to go with. I often will tell people your health insurance is a peace of mind, something you have in place in case you need it. You hope you never have to use it. Which route gives you more of a peace of mind? A lot of people would rather pay more monthly premium and know you don't have to deal with network. You don't have a private insurance company dictating your care. You know exactly what to expect with your out-of-pocket costs. And it's just easy insurance, and that's Medicare with a supplement. And that's the route to take. Some people lose sleep at night knowing how much premium they're paying. They like all the ancillary benefits, the extras with the dental, the vision, the gym access, and things like that. And the networks, the copays, the private insurance company involvement, well, those are all things they've dealt with all their life, and it doesn't intimidate them. And in that situation, maybe Medicare Advantage is the right pick for you. Either way, we can be a resource for you where we can walk you through your benefit options, whether you go supplement or Advantage plan. We can discuss which companies are available to you, what premiums they charge, what benefits they offer, and we can have this dialogue and conversation year after year just to make sure you're always in a plan that makes the most sense for you. We hope this video was a blessing to you. If you do have more questions, give us a call, 316-260-3331. We'd be more than happy to answer any questions you have. I do want to mention one more thing. If you want to dive a little deeper into your benefit options, if you want to have something written down on hard copy paper that you can read and highlight, because health insurance is really important, you can go to our website, advisemedicare.net, and request a free copy of my book, Medicare Made Simple. Or just give us a call, 316-260-3331. Let us know, hey, I want a free copy of that book. We'll ship it out to you, no questions asked. We want to be a blessing for you. We want to help you navigate these waters so you feel really confident in the coverage you have. Again, I hope this video was helpful. Don't hesitate to reach out. Thank you for watching.